Hello and welcome to another GIS report, reporting for the Ministry of Health and Social Development. I am Public Health Communications Specialist Natasha Letzum. Today we're here at the BVI Red Cross as they host their annual Men's Health Fair, where some of the testing including today are going to be prostate screenings, screenings for diabetes, hypertension, and there's a myriad of other amenities that men can find here as they seek to improve their health. Today, our hostess will be the director of the Red Cross, Ms. Fred, who is going to showcase her operation here and let our viewing audience know exactly what is going on here or what goes on here at the Men's Health Fair. So stay tuned. We'll get started right after this commercial break.
Yes, hello?
Hey Sean, what's going on? You sound upset.
Nah, this is a bank, they keep harassing me. They want me bring in either my passport or my driver's license so they could update my information on diligence process. I mean, come on man, I've been going to this bank for the last 15 years, they should know me.
They used to get on my nose too, until I asked them why they were doing it. Essentially, people's circumstances change and what may have been the case 5 years ago is not the same today. It's the same case with the bank. They need to conduct their updates to protect you, to prevent handling dirty money, to prevent money laundering, to prevent terrorist financing, and because it's the law.
Well, since you put it that way, I guess I could do that all in the morning on my way to work. I could probably drop it off and pick it up later.
Okay, bye.
This message was brought to you by the National Risk Assessment Public Education Committee and this station.
We're here with Ms. Helen Fred, and she's the director of the Red Cross. Ms. Fred, we see you have such a wide event here today. Tell us what's going on.
Well, today is the Men's Health Fair and the prostate cancer screening for the Red Cross. This is an annual event that is the prostate cancer screening. But this year we've introduced for the first time the Men's Health Fair because we realize now that we could offer a lot more to the men. And we are trying to include the younger men now. The prostate screening is usually for men over 40. So we are trying to capture the younger men from age 25 and over.
Well, I know this is the first time I've been to one of the health fairs or one of the screenings, and I'm amazed to see so many men. I think originally I thought that men don't actually come out. So seeing that this is an event, an annual event, how have you seen the change in the mindset or the paradigm of men over the years as it relates to their health?
Well, when this screening started 18 years ago, there were only 46 men. So over the years, the numbers grew. And in 2012, we went over the 1,000 mark. Yes. But since then, the numbers have been decreasing because as we test the men each year, more and more men are knowing their results. And if they are normal for a number of years, they don't need to come every year. So they can take a break for a year and come back. So last year, we had only 574 men. But that was okay too. I'm not sure how many we will get this year, but we are hoping that we will still see the younger men. We haven't seen them as yet for the day, but I'm hoping that they will still come.
Now, why is this event for you important? As government aims to go towards a healthier Virgin Islands, what role do you, the Red Cross, see you playing in that capacity to ensure that, we move towards that healthier lifestyle?
One of our mandates is to meet the needs of the vulnerable. And men are vulnerable because they're the ones who don't go to the doctor and they don't know some of these conditions that they may have. And as we know, prostate cancer is one of those silent killers. And so as we are looking at silent killers, we also think on things like hypertension and diabetes. And so we're also trying to reach them to be able to check those areas as well.
Now, if a man was to come here and be diagnosed with prostate cancer or any other illness, then what happens next? How do you fill a gap in terms of transition and treatment, or what do you do after you realize that somebody does in fact have the prostate cancer?
What we do when we get the results, we call them in and we let them know whether they have a normal or an abnormal result. If the result is abnormal, we advise them to go and see their doctor, and their doctor can refer them to a urologist, or they can go directly to a urologist. We have some on the island now.
Now, I would like for you to kind of give us an idea of how the process goes from the time they get here. What is it they need to do? And if you could just give us a tour of the facility and, each station.
Okay, well, we start out here. The men sit under the tent and they wait until they're called. They register. This is the front desk here. And so they register at the front desk and they get a number. And then they're called by their number. One of the volunteers will take them through the process. We've had men sitting here from about 4 o'clock this morning, and we started at 6. And so far we've gone over 100 men. I'm not sure how many they've gone so far, but I know we're over 100. So we start here at the front desk where they're given their number, and once the number is called, then one of the volunteers will take them, fill out the registration form, and take them on the inside. So we can go on the inside and.
Now, as part of the registration process, what type of information do you guys capture on the form?
Oh, their name, age, date of birth, the NHI number we've just included since NHI is now on stream, and their address, contact details, and we also try to find out from them if they've been here before, and if they received their result from the previous year, if it was normal or abnormal, and we also try to find out if they have any history, any family history of any prostate problems.
Well, that covers the reception area, so we'll go inside now and you'll take us through the different stations.
This is the second station. So this is the station where the information is entered into the computer, or the volunteers here, they look for their information and give them or write their 2015 results on their card and on the form as well, the form that goes to the doctor.
So now this information, saying that you said that, now that NHI is on board, is there any plans to share this information possibly in the future, or you just keep the information for Red Cross?
We capture the information now because we're not sure as yet how it will be used, but as NHI comes on stream and we see how we could work together, we'll decide as we go forward. This is station 3. This is where the blood is drawn for the PSA, and we have 5 persons drawing blood today. The blood is drawn, so we get a venous specimen that is used to test the PSA. And from here, the men would go and they are educated about prostate cancer and what the PSA means.
And what exactly does PSA mean?
Prostate-specific antigen. It's a protein that is produced in the prostate.
Okay, so prostate you can check through the blood, and plus so if you check it through the blood, then why do you need the other? Yeah.
Well, both are important because the digital rectal examination, or the DRE, that one tells the doctor what the prostate feels like, is that the consistency and the size of the prostate, and so it gives an indication if he's having an enlarged prostate, or if there is a problem, or if it feels cancerous.
Now, do you ever have situations where the blood might say no, but when they do the rectal scan, it's saying something else?
Yes, but I can't tell you the percentage, or how often that happens.
So it's imperative that people do both?
Yes, I think it's very important for both tests to be done.
So do you partner with the Health Services Authority to, get the blood analyzed?
Yes, all the blood tests are done at the hospital laboratory. And the hospital also lends us their centrifuge, and we spin the blood here before we take it to the lab.
So is it at a reduced price, or you still absorb the full cost?
I am not sure if it's the full cost, but I think they give us that cost price.
And how is it that you could afford to have this event for free?
Well, we are so thankful. That's a good question, because we are so thankful for all of our donors and supporters. We get financial assistance and we get donation in kind. And so at this point, I would really like to thank a number of persons who have assisted us. We want to thank the hospital, as you said. We thank the Social Security Board, because they are our main sponsor, and they've been sponsoring, I think, since the inception of this program. The Popeye always lends us his tent. He couldn't help us this year because of another situation. So we would like to thank Tooltown and Pastor Naaman Chalwell for assisting us with the tent, as well as Agricultural Department. We thank Ms. Sarai Smith of Crown Marketing for helping us to get the word out, and Ms. Carol Smith for designing the flyers and the banners. Also, we would like to thank some of the insurance companies for coming through and giving donations, such as Alfonso Warner. We usually get assistance from Caribbean Insurance and from Nagico. I would also like to thank Newton Construction for their assistance. Thanks to the Rotary Clubs, they send their volunteers out to assist with getting the men through the process. The Lions Club helps out at times. We also get assistance from our own volunteers and from the public. Persons come in readily and assist. And so if I forgot anyone, it wasn't intentional, but we would really love to say thank you very much for all that you do for us. And that is the reason why we're able to offer this free of cost, because of all the support from the community.
Awesome. It's wonderful how the community pulls together in the time of need, and this is definitely a time of need. We're talking about the health of the people of the territory. One of our vulnerable groups, as Ms. Fretton mentioned earlier, are men in our male population. As we all fall short of healthier Virgin Islands, and we want to extend another thank you to all the persons who contributed in any way, shape, or form to making this event a success. You continue to, give your donations and your support to this event, as it is very vital for the people of the territory. Thank you again.
This is Station 4. This is where the men receive some education about prostate cancer and about the PSA test. Miss Cindy McWilliams, Dr. McWilliams' wife, she's providing the education. And she's been here every year with her husband for, I think, the past 15 years.
All right, this is a diagram of a body of a man, his lower half. This is the bladder. This is the prostate gland. And the bladder is full of urine, and this little tube right here takes the urine out of the body. And so it's important to understand what the prostate gland does. That's what we're testing today. The prostate gland is only about that big, about the size of a walnut. But if the prostate gland becomes swollen with an infection, or sometimes as men get older in their 60s and 70s, this prostate gland just swells with age. And anytime that happens, or if there's cancer in the prostate gland, it squeezes on the water passageway. It squeezes on that tube, and it is hard for urine to come out the body. By that time, we know something's wrong if you can't get your urine out the body. So we want to do a test. Maybe if it's an infection, you can have medicine and that will cure it. If it's gotten enlarged because of age, you can also take medicine and that will help. But if it's cancer, we need to know that also so we can do an operation. So when you come for the first time, you will have the PSA test, which stands for prosthetic antigen or specific antigen. PSA. That's why it's easier to say the letters than the whole name. And that number, that first number you get, is very important, because from then on, as you have different tests over different years, we'll compare your first number to see if it's going up a little bit each year, which is normal, or if it takes a big jump, that's not normal. And that tells us something's wrong. Either it's an infection or it's cancer. So that's why it's so important for men between the ages of 40 and 50 to have 1 or 2 tests. And then by the time you hit 50, between 50 and 70, we want you to come every year and be tested. Unless you have a real low score, then you might be able to skip a year. Now, today, since this is the first time, what the doctor's going to do, he's going to have his hand gloved, he's going to go through the rectum, and he's going to touch that prostate gland. It's very brief, it's uncomfortable more to your mind than to your body, but very briefly he can tell whether that gland is normal or not. So today before you leave, you know that that gland had a normal checkup and everything is fine. Then in a couple of months, when your test comes back here to the Red Cross and you have a number, it might be 0.72, it might be 1.45, something like that in that range. You'll know that his normal exam and your number both mean normal for you. So the next time you come, you'll look at that number to see if your PSA has risen a little bit or a lot. So that's why it's important to come back every year to see if it's rising. It's not enough to do the blood test, because it could be other reasons that make you have urinary problems. It could be an infection to make the PSA go high. But the test with the physical exam tells us whether you're normal or not. Okay. Now the information I'm going to give you here, well, you can take that home and read that. That will have more information in it. There's a website on the back that will also have more information for you. Any questions? Okay, all right. Well, I'm going to take you to the doctor's queue over there. After you see the doctor, then you can get in the queue over here for the other tests we offer today. And you'll give this to the doctor when you see him.
This is the area where the men would wait to see one of 3 doctors. There are 3 doctors with us: Dr. Constance Smiley, Dr. Charles McWilliams, and Dr. John Franklin. And so they would go to either one of the 3 doctors. So this is just the waiting area.
This is a screening event, and the patients, not patients, but men, come in to get their exam. They are invited in, although some of them are quite anxious when they do that. But the exam is, quite simple. We try to alleviate their fear, maybe say something funny for them to relax a little bit. But the goal is to examine the prostate, but it requires taking the clothes down, the pants and underpant, bending over, which is a simple thing to do, and the rectal exam is performed. It takes seconds, 15 seconds, 30 seconds, depending on the size of the prostate and what I'm feeling. There may be a little bit of discomfort, sometimes a little spasm of the rectal muscles, but any discomfort at all is probably, the worst case will be a minute. Most times it's seconds before that's passed. Okay, it's all worth it for 1 year of discomfort.
Now, what exactly are you looking for when you perform the exam?
I'm primarily looking for abnormalities, and the abnormality that we're looking for would be suspicion of cancer So this is a cancer screening event, and it's a hard spot in the prostate. Now that's a classic presentation. Other things would be, is the prostate asymmetric? And asymmetric in size, asymmetric in terms of how texture, how it feels. But that's primarily what we're looking for, some abnormality that would raise the suspicion that there was cancer in the prostate.
Now, based on the fact you say you've been in this community for a while and, attending these events, how have you seen the mind shift of the men in terms of their willingness to even have this screening done? Because a lot of the concerns of men is that it is a very private sort of exam, and it's always apprehension if a man does it as opposed to a woman doing it. But so how have you seen that shift over the years, or has it?
Actually, it's quite remarkable because the men out of the BVI are actually quite receptive to the exam. This has been a very productive screening event. We've had large numbers, particularly out of Tortola. Between the Friday and the Saturday, we've seen sometimes 800 plus men. I'm not sure we're going to get there this year, but clearly there is a willingness, the word of mouth, presumably through the advertisement, but the men do come. Like I said, there's a little bit of apprehension. It seems to be all in jest, but they show up in very large numbers. So I think that there is that reception here for the exam, and that's remarkable because typically it's perceived, as you just said, that there are real phobias to having the rectal exam.
No, one of the key messages of government is we're trying to achieve a healthier Virgin Islands, and we've identified men as one of the vulnerable population when it relates to their health and not, being proactive about their health. Now, how is this entire event, not only the cancer screening, but the health fair and men taking care of their health, how is that important? How do you see it towards that long-term goal as living as long as they could to, be with their family and being more healthy? Long term, how do you see this playing into that role?
I think that's a very important question because we've struggled with that issue. There has been a pushback against the routine screening, and that issue has came up for us to discuss whether this is an event that should continue, and we feel it should be more than just prostate cancer screening. And so that's very pertinent, and it will certainly work well within that wholesome view of improving health among the men, because they should not just come in because of the prostate cancer screening. That is important. They should continue to do it, but part of the effort here is blood sugar screening. Diabetes is extremely prevalent in our community. Hypertension is extremely prevalent in our community, and so if the prostate brings them in because there's that concern about it, concern of cancer, and if there's an opportunity here to entrap them, whatever we say, but at least to get them tuned into the other aspects of their health, and I think that works. And I think this is a very successful event in that regard. Possibly more people should participate, yes.
Now, leave us with a few tips. Are there any measures that can be taken from men to improve their prostate health, to protect their prostate? Is there anything that they could do to ensure that they lower their vulnerability to prostate cancer?
Again, very good question. But the simple answer is no. The best thing that they can do is being aware and, in fact, getting screened. Whether they take the philosophy that screening is not something that needs to be done routinely, they should talk to their physician about it. So when I talk to men who ask that question, what can they do for their prostate? My simple answer is the best prostate health is actually the best heart health. So when I think of heart health, I think about a good diet, I think about exercise, and so think about making the whole body healthy, and in doing so, you're making your prostate healthy. Okay.
Thank you very much.
At this station, the Diabetic Association is checking blood sugars, cholesterol, and blood pressure. Once the men are finished seeing the doctor, then they come across here and get those tests done. One of the things that we ask the men to do is to come here fasting. They should be fasting for at least 12 hours, so they shouldn't have anything to eat or drink after 10 p.m. except for water. Because if they eat anything, it will affect the results that they receive. Cholesterol and sugars should be done on an empty stomach, so it should be a fasting test.
And what is a healthy cholesterol level?
Below 200.
So tell us a little bit more information regarding the blood sugar test and the cholesterol test.
The blood sugar should either be done fasting or a random test is done if it's like 2 hours after the person eats. Fasting blood sugar should be between 70 to 100 milligrams per deciliter. Or a fasting test is about 130 to 140 milligrams per deciliter. And this is about 2 hours after the person has eaten. If the sugar is high, if it's above 125 for fasting or 170 for a random check, we now do the hemoglobin A1C, which is another test that will tell the person, if they're diabetic and what their blood sugars have been like for the past 3 months. So it will give you a good indication of how well the person has been controlling their sugar, or if they have high blood sugar. And we've diagnosed one person so far who wasn't aware that he was diabetic, but his hemoglobin A1C was very high. So I would like to take you over to that next station where I will get the volunteer to explain about that test.
This is a test that the Red Cross is offering this year for folks that have a elevated blood sugar. That test tells you what your blood sugar is instantaneously. So if folks are tested here and have a high blood sugar, they can come over here and do this A1C test, which gives the average of your blood sugar over the last 3 months. So it's a further indicator of the potential or the diagnosis of diabetes. And so we're offering this test here for those folks, those that are at risk or those that have high blood sugar, to make sure that they get to see their physicians. And so
after being exposed to this test, and say for instance the results are still high and that they are exposed or they have come in contact with diabetes or anything else, what type of counseling or what do you tell them after doing the test?
Well, if that their numbers are high, we tell them to seek medical attention. One thing that we do tell them is diabetes is treatable, and so with care and a proper regimen of insulin or whatever the doctor would prescribe, it's something that's treatable and you just manage. So hopefully we can get people the word out that it's not something but if you leave it untreated, then you can have complications.
And so far, have you seen a lot of cases that are diabetic?
Well, we have seen some, yes, for sure, and hopefully we can get those people directed to the right areas for medical care so that they can get on some sort of a treatment option. So we're pleased through the Red Cross to be able to offer this additional test this year. Okay.
Thank you for tuning in to this edition of the GIS Report with Health in Perspective, as we toured the operation of Red Cross's annual prostate cancer screening and men's health fair. I trust you've learned a lot. This is part 1 of a 2-part series providing coverage and lots of information regarding men's health. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha Letzum. Thank you for tuning in and join us next time for the conclusion of the program.